Our mouth contains a large number of bacteria. These bacteria attach themselves to the surface of the teeth and form a soft, pale yellow layer known as plaque. This plaque, if allowed to remain on the surface for a long time, begins to harden. These hard deposits on the surface of the teeth are called calculus or tartar. Also, certain kinds of foods and tobacco may leave stains on the teeth over a period of time. All these factors, if present in the mouth, eventually harm the gums around the teeth and even cause bad breath. Hence, it is essential to keep the teeth as clean as possible. Oral prophylaxis is essentially the cleaning of teeth, which is done by a process called scaling. It is a dental procedure that removes tartar and plaque built up from the teeth through polishing and scaling. This is important in order to keep the teeth and tissues surrounding the teeth healthy. Scaling is done either by hand scaling or by an ultrasonic scaling device. During this process, the dentist will remove all the hard deposits on the teeth as well as the stains. Scaling is done above and below the gums to ensure complete removal of any calculus or tartar. This procedure is not at all painful and is followed by polishing of the teeth to remove any soft deposits and leave a smooth finish on the tooth surfaces. Polishing is done using an abrasive polishing paste and a soft brush. The dentist may also recommend fluoride treatment after scaling and polishing. Scaling is not the same as tooth whitening, as it does not involve use of any bleaching agent. It usually takes 20 to 45 minutes for the dentist to complete the entire procedure, depending on the amount of calculus or stains present on your teeth. Also, the process may be completed in one sitting or could even take multiple sittings. Every patient is advised to get his or her teeth cleaned every 6 months. However, the dentist may have to recall the patient at shorter intervals depending on the rate at which deposits form on the surfaces of the teeth. There may be some sensitivity since the teeth are exposed to the surroundings after cleaning. However, this will be temporary and subside in a few days. There is a misconception that scaling removes enamel from the teeth. This is not true. Ultrasonic cleaning is done by high-energy vibration that makes the extra deposits to detach from the tooth surface. This equipment cannot cut the tooth. After cleaning, you may feel presence of gaps or spaces between the teeth. These spaces already existed but were filled by tartar. These spaces should be maintained by interdental brushes and floss to prevent further accumulation of tartar. You must follow the following instructions for maintaining good oral hygiene. Brush your teeth regularly. Brushing removes leftover food particles from between the teeth, thus helping prevent tooth decay. Brush at least twice a day and most importantly before you go to sleep. Good diet is most important for healthy gums and teeth. Food rich in calcium and iron are good for strength and stability. Avoid sugary foods and candy as well as junk food. Moderate your intake of coffee and wine as staining of teeth is likely to occur with excessive consumption of these. Avoid smoking and chewing of tobacco. Apart from its hazardous effects on your health, tobacco and tar in the smoke stain the teeth and make your breath stink. Mouth cancer can also occur due to the cancerous elements found in tobacco. Floss regularly. Though not common practice to a lot of people, flossing removes food particles that may be lodged between teeth. These particles, if left unchecked, can lead to decay in your teeth. Ask your dentist for what type of floss to use and how to go about it. Visit your dentist regularly. This is important as your dentist can keep progress of your overall oral health and advise you appropriately should a particular situation occur. Toothbrushes tend to wear out after some time and should be replaced every 3 to 4 months. A worn-out toothbrush is not effective in cleaning your teeth and should be discarded. Use toothpaste and mouth rinses containing fluoride. Fluoride strengthens teeth enamel, thus making teeth stronger and more stable in the long run.